Today we're going to talk about ankle sprains. Ankle sprains are a very common injury that impact the ligaments that support the ankle. A ligament is a type of connective tissue that holds bones together and provides stability to joints. An ankle sprain occurs when a ligament becomes overstretched or torn due to any movement that twists, rolls, or turns the ankle beyond its normal limits. Ankle sprains can happen to people of all ages and activity levels, and estimates show that more than 23,000 ankle sprains occur per day in the United States. There are 3 different types of ankle sprains, which are categorized by where the ligament sprain is and the mechanism of injury that caused the sprain. The first and most common type is an inversion sprain, or a lateral ankle sprain. There are 3 ligaments that function to resist excessive inversion of the ankle, so when the ankle rolls outward into a range that is beyond normal limits, these ligaments can become taut and tear. This type of ankle sprain can also be caused by excessive plantar flexion or a combination of inversion and plantar flexion. With this type of sprain, the most frequently affected ligament is the anterior talofibular ligament, the ATFL, which is the weakest ligament in the lateral region and thus the most susceptible to injury. However, if severe enough, this type of sprain can also impact the other 2 ligaments that resist ankle inversion. As a whole, these ligaments are not as strong as the ligaments on the inside of the ankle, which is one of the reasons why a lateral ankle sprain is the most frequently seen type of ankle sprain. The common example of a movement that might cause a lateral ankle sprain is stepping off a curb or down a stair where the foot is both plantar flexed and inverted. A lateral ankle sprain is also frequently seen in activities such as running, jumping, or those that include a lot of lateral movements like cutting. Uneven ground or the wrong type of shoes can also contribute to lateral ankle sprains. The second most common type of ankle sprain is an eversion sprain, otherwise called a medial ankle sprain. This sprain affects the deltoid ligament complex on the inside of the ankle, which is a group of 4 separate ligaments that function to resist ankle eversion. As mentioned, these ligaments are less frequently injured because they are stronger than the ligaments on the outside of the ankle, but they are also supported by bony anatomy. The fibula bone, which runs down the lateral side of the lower leg, extends down further than the tibia does on the medial side, which prevents the ankle from moving in a way that can overstretch the medial ligaments. However, though this usually helps protect these strong, shorter ligaments from excessive eversion, it also means that a medial ankle sprain requires so much force that is often accompanied by a fracture of bones such as the fibula, tibia, or talus. Similar to an inversion ankle sprain, common movements that cause an eversion ankle sprain include running and jumping. The last type of ankle sprain is a high ankle sprain. A high ankle sprain involves ligaments above the ankle that connect the distal ends of the tibia and the fibula. These ligaments form what is known as the syndesmosis between the 2 shin bones. A high ankle sprain is most commonly caused by excessive rotation at the ankle, extremes of dorsiflexion, or a combination of these movements. This usually results from sudden twisting, turning, or cutting motions while the person is running or jumping. These sprains can be harder to identify because of their location and also might require a longer recovery period than other types of ankle sprains. As a whole, ankle sprains can be diagnosed via imaging tests such as X-ray, MRI, or ultrasound to examine the amount of tearing present and to differentiate from other possible injuries such as a broken bone. A physical exam with a doctor may also include palpating the affected areas and looking at the ankle's range of motion. The ankle sprain is then assigned a grade, which defines the extent of the damage and the severity of the injury. These grades also help guide treatment and further plan of care. So a grade 1 is a stretching or a very light tearing of a ligament. There will be mild tenderness, swelling, and stiffness. The ankle still feels stable and the individual is able to bear weight and walk with a minimal amount of pain. A grade 2 is a bit more severe and it's a partial or an incomplete tear of one or multiple ligaments, most likely accompanied by moderate pain, swelling, and bruising. A grade 2 feels somewhat stable, but the damaged areas are tender to touch and walking is usually painful. A grade 3 is the most severe, and this is a complete tear of the affected ligament or ligaments with severe swelling, severe bruising, and very much tenderness. Walking or weight bearing on the ankle is usually not possible due to instability or intense pain. After an ankle sprain, physical therapy treatment will focus on restoring range of motion of the ankle, strengthening exercises to increase stability of the ankle and foot, proprioception and balance training, as well as endurance and agility training. Did you know that if you sprain your ankle once, you are 3.5 times more likely to sprain it again? So it is very important to properly treat an ankle sprain. The doctors at OCPT can help you treat an ankle sprain with the appropriate care and attention and take the necessary steps to prevent future recurrences. Thanks.